I'm Dr. Lisa Palmer, Dr. Mama Bear, being photobombed here with my furry friend. And our topic today is side effects, signs, and symptoms. Side effects, signs, and symptoms. If you're there and you want to say hello, go ahead, pop your name in the chat. Otherwise, oh my goodness, I, as a holistic physician, I don't even have the proper adjective to tell you guys. I don't even know what the best description would be to the amount of frustration that I feel with people taking medications that every single time they take them, every single medication, whether it's over the counter or prescription, has a side effect. Your liver has to break things down. Your liver scans for toxicities. And so if you are taking a medication, whether it's Tylenol, ibuprofen, aspirin, Ozempic, lisinopril, whatever the medication is, those are all medication names, whatever the medication is, whether it's over the counter or from a prescription, it always has a side effect. And I can't tell you how many patients I've worked on that the things that they're complaining about are signs and symptoms of side effects from their medications. It drives me nuts. I don't know about you guys, but it absolutely drives me nuts. And so I was talking to someone today, and the patient has high blood pressure. The doctor wants him to take a diabetes medication to strengthen the heart. Well, my first degree is in sports medicine. My next degree is in chiropractic. And then all of my continuing education, all of my postgraduate education is all in holistic nutrition, right? So I have sports world, I have chiropractic world, I have nutrition world, holistic nutrition, not dietitian nutrition. And it's craziness to me. So the diabetes medication was prescribed to this person. And of course, the person's not diabetic. One of the side effects of the medication is it seems to strengthen the heart, right? And so it's kind of like what they would consider an off-label utilization. But if the person doesn't have diabetes, if the patient doesn't have diabetes and they take a medication for diabetes, it's going to lower blood sugar. So then now the patient is getting drops in blood sugar, which can make you not feel so good. So it's kind of like, the saying, rob Peter to pay Paul, right? It's cause this problem to fix this problem, which is not fixing the problem. You have to look for the cause. And so in holistic healthcare, we look for the cause. We look for what is occurring. We look for, I'm getting a photobombed by my daughter, getting a photobombed by my dog. You want to say hi, everyone? So Leah, I have a question for you. So my question is, if you had, what's your favorite stuffed animal? What is your favorite toy that you have?
I don't have any.
You don't have? They're all amazing. So let's just pick your red unicorn.
What?
The red unicorn you got from Grammy and Papa on Valentine's Day last year that you call Valentine.
Or
Valentine's. Hi, Robin. Hi, Jonathan. And so say we take your red unicorn and we chop off, this is very violent, we chop off Valentine's arm.
I'll make you buy a new one.
You'll make me buy a new one. But what if I fix it by taking out his eyeball?
I'll make you buy a new one.
Make me buy a new one. But does that make sense at all to you? That's what they do with side effects, is they give you a medication for one symptom, and then the medication has side effects, which causes another symptom. It doesn't make sense. If you apply that thought process to any other profession, you would think that they're the worst whatever that you've ever found. So example I like to use is a mechanic. You take your car to the mechanic, say that you have problems with the brakes. They cut out your brakes because they're a problem, and they send you with, they decide that they're going to, remove a headlight. So now you're missing a headlight and you have no brakes. Now you have more problems. It doesn't make any sense. It does not, that way of thinking does not apply to any other profession. It doesn't apply to plumbing. It doesn't apply to car mechanics. It doesn't apply to carpentry. It doesn't apply to anything. It is absolute insanity. And I don't know about you guys, it drives me nuts, right? So recap, every single medication has a side effect. When you have a symptom, it means something is wrong in your body. And you can take a medication that has side effects, but what we like to do in natural health care, what we like to do in quantum nutrition testing, what do we like to do? How do we find what's wrong? If you're going to photobomb my live here, then you can, I'm going to ask you questions. Test. They didn't hear you talking to the mic.
Test.
They're going to test. We're going to test. We're going to find out why. We're going to find the cause. We're going to find out, is it due to mold? Are we going to find out if it's due to chemical toxicity? So I was just checking 2 young patients today, and they were both testing for chlorine. Where does chlorine come from?
Pools.
It can come from pools, right?
Or the container.
Or it can come from the container. What container?
The container comes in.
Oh, chlorine then. Okay, yeah, so it can come in that. Ethan says, hi, Peanut. I heard you, Leah. Ah, Ethan heard you. But it's all done. What are you doing? He called you Peanut. Yeah, he called you Peanut. So chlorine in our water supply is a toxin. It negatively affects the thyroid gland. The thyroid loves iodine. Most people don't get enough iodine in their food. It can come from seafood. It can come from seaweed. It can come from minerals, like trace minerals. And so if you're not getting enough iodine, your thyroid's not going to function properly, and you're going to feel tired. You're going to gain weight. Your hair is going to fall out. You might get really puffy.
Mommy.
What?
You told me to pick my favorite stuffy, but if you're going to take anything off, I might as well pick my least favorite.
Oh, true. So yeah, so you picked Valentine, and we decided that giving a medication is like, because medications always have side effects, it's like chopping off your Valentine, chopping off your stuffed animal's arm, and trying to fix it by taking out its eyeball. Like, it just doesn't work.
Horses kick, and Valentine's technically like a horse pony.
Oh, Valentine's a horse pony. Got it.
So if you ever try to give her a drug, she would probably just kick it.
Yeah, so animals know, right? Most animals, if you try to give your dog medication, what do? They run away. If you try to give your horse something, you're right, they try to kick you. They know, they don't want the chemicals. So I am not saying if you're on a medication to stop taking the medication. I am not saying there's not a time and a place. Like if you're rotting from some nasty bacteria, then yes, you might need an antibiotic. But I am saying, if there's a sign, if there's a symptom, we want to find the cause. And with quantum nutrition testing, we're going to look for the cause. We're going to look for the imbalance in your system. And then instead of giving you a medication to cover up the symptom, we're going to look for what is the cause. Is it mold exposure? Is it chemical exposure? Is it metal exposure? What is exposure? How are you going to handle it? Me and May, how are you going to handle it? We put together a personalized program for you, and we help to find the solution. I'm Dr. Lisa Palmer, Dr. Mama Bear. If you need help, what should they do, Leah?
Call 47321.
You're talking the mic.
Number already.
You forgot our office line? What's the name of our office?
Palmetto.
You got to talk in the mic. You're gonna photobomb my live. What's the name of our practice?
Palmetto?
Yeah, Palmetto Health. Call us, and we will see what we can do to help you. You know the phone number.
I forgot it.
It's 407-682-8444, and we would love to help. Good night, everyone.